Hello and welcome to the another part of excretion. We are into the pharmacokinetics and we have already discussed about the renal eliminations or excretion of drugs. So we are proceeding with therapeutic window phenomenon. Now what is therapeutic window? Now here in this graph it's time versus plasma concentration figure. As the time increases, the plasma concentration of drug rises, it reaches to its peak, and then because of metabolism and excretions, the concentration of drug decreases. Here the two important things. One, this line. Above this line, there is a desired response. So this line is basically indicating a therapeutic response, above which if the concentration goes above that, only then we are getting the desired response. But we need to keep the concentration below this line. This is a line of adverse drug response or side effects. So if the concentration goes above that line, there are chances of adverse drug reactions or negative effects or the side effects. So we need to keep the concentration of drug between these two lines, and this window is called as therapeutic window. Now what is clinical significance of this therapeutic window? For an example, drug X having therapeutic window that much and drug Y as having therapeutic window that much, are quite narrow. So here what you can say is drug X can roam around in more space, right? So it's having a more luxury of space, so you can fluctuate its concentration more. But what about drug Y? Here the fluctuation space is very little fluctuation space, because if the concentration goes below this space, there won't be any response, and if the concentration of drug Y goes above that line, there is chances of negative adverse drug reactions. So this therapeutic window indicates if this therapeutic window is wide, the drug is safer, and if the therapeutic window is narrow, the drug is very risky, dangerous. Okay, so this is a clinical significance of this therapeutic window. Let's jump to the next topic, that is therapeutic drug monitoring. Now, as the name suggests, it's a drug monitoring. So, what it's a procedure in which the concentration of drug into the blood or into the plasma is measured. So, it is actually measuring a drug concentration into the blood. So, when do we need to measure the blood concentrations of a drug? So, first, in case of drugs with low safety margins, as we have already discussed, drugs with narrow therapeutic window or low safety margins, because in this low safety margin drugs, if the fluctuation space is very little, so if we increase the concentration, there are chances of adverse drug reactions. So we need to check exact blood levels of that particular drug, and for that we are doing TDM, therapeutic drug monitoring. So drugs with low safety margin, for an example digoxin, that is used as an congestive heart failure drug, anticonvulsant medications, antiarrhythmic medications, some of the antibiotics like aminoglycosides, lithium, which has been used in mania, like tricyclic antidepressant in case of depression. So these are the drugs you need to remember, which are having a very lower therapeutic window, narrow safety margins, and in which therapeutic drug monitoring is necessary. Second, drugs in which individual variations are large, like antidepressants and lithium produces larger variations. So for that, to check the response, why this response is delayed, you need to do therapeutic drug monitoring. You need to check the level of drugs into the blood. Third reason why we need to check the concentration of drug into the blood is for toxic drugs, right? Especially toxic drugs if we are using in presence of renal failure. Patient is already having a renal failure, patient is already having difficulty in excretion of that particular drugs, and we are using toxic drug, then we need to make sure that we are into a proper therapeutic window. So for that, the drugs like aminoglycosides, vancomycin, we've been checking through this TDM. Fourth, in case of poisoning, right? If poisoning is the case, we need to check the exact concentration of that drug into the blood. So we take out the blood and we check the concentration of that drug. In case of failure of response, if you're treating a patient of infections and the infection is not being treated, so you need to check whether the concentration of that drug is being achieved enough in the plasma. So for that, you do this therapeutic drug monitoring and check the reason of failure of that drug. 6, the patient compliance. Sometimes you are you are prescribed the drugs, but patient might not be taking that drug, and because of that the infection is not being treated. So to counter that, you are taking a sample from his blood and seeing the concentration. So then you can decide the patient is taking the drug or not, and these are useful in psychiatry patients, the chronic conditions. This would be really beneficial. So therapeutic drug monitoring has been done in these different scenarios, especially with low safety margin drugs, with high variation drugs, toxic drugs, in case of poisoning, in case of failure of therapeutic response, and in to check patient compliance. Now, in which cases the TDM is of no use, right? So cases where you can measure the response easily, right? So for an example, antihypertensive, we have the blood pressure machines. Hypoglycemics, we can check the sugar levels easily. Oral anticoagulants, general anesthesia. For these drugs, we are having other measures, right? They are more accurate. So for that, the TDM is bit tedious. So in that cases, we generally don't use TDM. We use or we rely on other methods. Drugs which gets activated in the body, like for an example prodrugs, like they are as such inactive but gets activated in the body, so it requires one more step to get activated, so that in those cases therapeutic drug monitoring is of no use, right? So prodrug, in the cases of prodrugs which gets inside the body and then eventually gets activated, so it will provide a false figure if we do TDM. Now the third thing is hit and run drugs. Now what are these hit and run drugs? Means these drugs having short half-life. Their half-life is bit short, but their duration of action is long, right? So how can this happen? So this drug gets at their site of action, inhibits or acts at their site of action, and eventually gets excreted from the body. But because the way they have produced its effect acts in such a way that long duration of action is achieved. So drug gets hit and run out of the body, and that is why it is called as hit and run drug. It hits its target, gets out of the body, so run away, but its action lasts for longer time, right? So that is why it is called as hit and run drug. Again, I'm telling you, it hits its action, runs away quickly out of the body, but its action, its duration of action is for longer time. For an example, drugs like omeprazole, like for an example, these omeprazoles remains in the body for 10 hours or 20 hours, but its action lasts for more than 20 hours, that is 40 hours or 45 hours, right? So this is how these hit and run drugs work, and therapeutic drug monitoring is of no use because you won't be able to find the drug in the body, but still there would be response. So it produces false perceptions, and that is why TDM is of no use in this. So in easily measurable conditions and in hit and drug cases and in cases of prodrugs, therapeutic drug monitoring is of no use. Now the next aspect is how can we prolong the drug action. Now first of all, let's talk about what are the advantages of prolonging the drug actions. If we prolong the drug actions, the frequency of administrations obviously decreases, so it becomes easy for patients, more convenient for the patient to this drug. If one doctor prescribes 2 tablets a day and if one prescribes 1 tablet a day, obviously the patient would prefer the second doctor. So it improves the patient compliance. It's better especially in case of chronic conditions like for an example diabetes, hypertension, so these depression, so these are the conditions where patient need to take drug for longer time. So if we are having less frequency, it would be better patient will take the drug for longer time. What are other advantages of prolonging the drug actions? Large fluctuations in plasma concentration would be avoided. If we are prolonging the drug actions, the fluctuation in the plasma concentration would be avoided because we are taking the drug and producing actions this way. And if we are taking a longer acting drug, it produces its action in this way. So fluctuations are avoided in prolonged action drugs. Drug effect could be maintained overnight without disturbing the sleep. So if we are giving a longer acting drug, especially in case of long acting insulins we are injecting, so those long acting insulins, it would be helpful for patients to maintain its glucose level over the period of night, and patient don't need to wake up and take the drug. So how can we increase the duration of action of a drug? So first we can do is, especially oral form, is making sustained release tablets and spansules. Now we have already discussed, or we will be discussing in practical aspect, but let's talk about briefly what are sustained release tablet. Most of the tablets in brand name ends with SR, and that is sustained release tablet. Means this tablet releases the drug gradually so that their plasma concentration remains above the therapeutic level for longer time. So this is a therapeutic level and we can maintain the plasma concentration above that for longer time. So gradually gets released, so it maintains above the therapeutic level. We can make spansules. It's a one form of capsule where the different layers is around the core and eventually every core gets disintegrated so that the action can be prolonged. So many of the capsules are which are sustained release are called as spansules. How we can increase the duration of action through parenteral route? We can obviously choose subcutaneous and intramuscular injections, and they eventually gradually releases the drug and the plasma concentration can get maintained, especially longer acting insulins. Oily preparations, these are called as depot preparations. These are mostly used as an oral contraceptives. The depot preparations been injected subcutaneously. This includes pellet as well as implants. This remains inside the subcutaneous tissue and this releases the drug gradually over the period of time. So these implants work for 2 to 3 to 6 months depending upon its characteristics, and some implants are biodegradable and some implants are non-biodegradable. So some need to remove and some need not to remove. So this provides action for longer time. Only once depot injection is enough and it will provide its action for this many months. We uses local anesthetics with adrenaline, right? This is one more question that is asked in examination. Why local anesthetics is being used with adrenaline? Because adrenaline is a vasoconstricting drug, so it constricts the vessels, so it will, that would be many benefits. First, it will provide bloodless field because the area is vasoconstricted, less blood will spill out if local procedure is being done. Second thing is the duration of action of local anesthetic increases. The local anesthetics duration of action increase, so it increases the duration of action of local anesthetics because local anesthetics now can act for longer time if there is vasoconstriction is there. So, and the third important thing is this adrenaline, because of vasoconstrictions, less of the local anesthetic goes into the systemic circulation and decreases the side effects. So less exposure of this local anesthetic to the systemic circulations and decrease side effects. So increases bloodless field, increases the duration because of vasoconstriction, so less drug gets eliminated and eventually less drugs gets exposed to the systemic circulation. We can also use transdermal drug delivery system for that, and they gradually releases the drug we have already seen, and we can maintain the level above this therapeutic level for longer time. We can increase the plasma protein binding. We have seen the plasma protein binding having its role in increasing the duration of action. So again, plasma protein binding is an important thing. If we can increase the plasma protein binding by anyhow providing proteins, we can increase the duration. We can increase the duration by decreasing the rate of metabolism. If we decrease the rate of metabolism, and here comes the concepts of enzyme inhibition, right? So if we give drugs which inhibits the enzyme, it will increase the duration of actions, and many examples we have covered. One more example is ritonavir boosts the level of indinavir. So many of the anti-HIV drugs are given with ritonavir because ritonavir is an enzyme inhibitor which increases the concentration of other drugs. Right? So this is one more examples of decreasing metabolism. Other example is cilastin and imipenem. Imipenem is an antimicrobial drug. If we give, its metabolism occurs in the kidney. So if we give it along with cilastin, that cilastin inhibits its metabolism, so imipenem concentration increases. So this is the way you can increase the duration of actions. You can also decrease its renal excretion. Renal excretion can be decreased, and we have seen the example classical of proben acid given with penicillins. And lastly, we can use some targeted delivery devices. For an example, liposomes and drug releasing implants. Let's say briefly what liposomes are. Liposomes are basically this kind of structure where the core portion is mainly aqueous. The aqueous core portion is there where we are mainly providing drugs. So drugs would be there in this core portion. There might be drugs, there might be nutrients, different things would be there. And this external aspect is made up of lipid bilayer. So aqueous core and this lipid bilayer eventually makes these liposomes, and these liposomes we can deliver to the targeted site, to the particular site, so that the duration of action increases and more drug reaches to the target sites. And second is drug releasing implants, and we have seen in case of copper teas, the drug called copper teas. This copper tea with drug releases the drug eventually, gradually, and the plasma concentration can be maintained above the therapeutic level for longer time, and it can produce its actions for 6 months or 8 months as well. So these are the different ways of increasing the duration of actions. Thank you very much.